Okay, this is your femur. It's a nice bone. You can use it for a weapon. It's good and sturdy. And this is the anterior view of the femur. Here we have the head of the femur, and you'll see this indentation right here. This is the fovea capitis. This is the neck of the femur. And these very large muscle attachment sites are called the greater trochanter and the lesser trochanter. And the region between the trochanters, this region between, this is called the intertrochanteric crest. And this is located on the posterior region of the bone. The posterior, you know if it's the posterior region of the bone if it's all roughed up. The anterior region of the bone is very nice and smooth, very smooth. How that is. So if we go back to the posterior region of the bone, where we have the greater trochanter and the lesser trochanter and that intertrochanteric crest, below that region, it's a very rough region of the bone where the gluteal muscles attach, and that's called the gluteal tuberosity. Below the gluteal tuberosity, we have the linea aspera, which separates into two lines. On the medial region of the bone, the line is the medial supracondylar line, and then we have the lateral supracondylar line. These two lines right here, you don't have to know those lines. Sorry to teach them to you. You don't have to know them. And they go down into the condyles. We have the medial condyle and the lateral condyle. It's hard to figure out in this view which is the medial and which is the lateral condyle. These condyles articulate with the tibia. We know, if you can see the whole bone, which surface is which, because the medial condyle lines up with the head of the femur, and the lateral condyle is on the other side. So sorry that we can't see the whole surface of the bone. So we have the medial condyle and the lateral condyle. And in between there, this is the intercondylar fossa. If we flip the bone over, we see the smooth anterior region of the bone. This is the patellar surface. This is the region that the patella articulates. This is the plain joint between the patella and the femur. And the only other region of the, well, actually there are two things that haven't gone over so far. These are the condyles. This is the medial condyle and the lateral condyle, and on the outer regions we have the epicondyles. So this would be the lateral epicondyle and the medial epicondyle on the outer region. And on the medial condyle of the bone, there's a roughened region right here, and you can feel it. It's hard to see in the video maybe, but on a real bone you can feel it. There's a roughened region called the adductor tubercle. Sorry, I'm getting tripped up on my own tongue, but this is the adductor tubercle, and it's roughened up because this is where the adductor magnus muscle attaches and it causes the leg to adduct. Trying to see if I missed anything on the bone, and I've missed one region. If we go back up here to the greater trochanter and the lesser trochanter, again this is the intertrochanteric crest. If we flip it over, there's a region called the intertrochanteric line between those two regions on the anterior region of the bone. And that's it. That's our whole femur.